I welcome you and I greet you with tenderness and appreciation wherever you are on our beloved planet Earth. Today, I'm going to be talking about 10 surprising facts about dizziness and vertigo. You know, the older that we get in life, the more we suffer from those ailments. I've been having dizziness and vertigo. May he rest in peace, my stepfather, who recently passed at the age of 82. Frequently, I say at least once every 2 months, had spells of dizziness and vertigo that made him lose his balance. Today, at the school I was working at, or I work at, I was talking to another teacher, and she told me when she saw my article in her classroom that she has a mother-in-law who is experiencing vertigo. When we're young and vibrant and powerful, we don't experience much dizziness from our bodies. We may experience from external sources, but we usually are not the cause of it. When we get older, it becomes inborn ailments within our bodies that cause us to suffer from dizziness and vertigo. Dizzy spells and vertigo may be caused by different factors. Learn the potential reasons you may be dizzy, plus why you may be experiencing nausea. So it's three things: dizziness, vertigo, and when you have those two, you usually experience some type of nausea where you want to vomit or you start to feel sick because of that feeling. This article was posted by Sarah Offsaw, and it's a recent article. Well, it was last updated in 2017. So, many of us have found ourselves asking the question, be it in ordinary days or in times of illness, why am I dizzy? While dizzy spells can be uncomfortable, it probably won't surprise you to learn that occasional dizziness is very common in adults. So, it's a common bodily event. But you may have not suspected that vertigo, which I believe is far worse, a related but more serious condition that makes you feel like the room is spinning as you stand still. It's also common, affecting nearly 40% of people over age 40. As I stated earlier, the older you get, the more your body may betray you and make you susceptible to dizziness and vertigo, as the article is showing. Over age 40 at least once in their lifetime, according to the University of Carolina, San Francisco Medical Center. So how do you know if you have vertigo or ordinary dizziness? The main difference is vertigo can cause nausea and vomiting, as stated earlier, and may be a symptom of serious balance disorder, which was also stated earlier in one form or another. While dizziness simply makes you feel momentarily unbalanced, that said, dizzy spells can range in severity from merely annoying to seriously debilitating, like when my elderly stepfather was falling. It was a serious condition. Here are what causes vertigo and general dizziness, plus what to do if you experience one of these dizziness. Number 1, dizzy spells may be caused by an inner ear problem. One of the most surprising causes of dizziness is being paroxysmal positional vertigo, or BBV, says Gregory Whitman, MD, an ear and brain specialist with the Massachusetts Eye and Ear Balance and Vestibular Center at Braintree Rehabilitation Center or Hospital in Massachusetts. Your inner ear contains calcium and protein-based sensing crystals called octoconin, says Dr. Whitman. If these crystals are dislodged and float into your inner ear canals, you may have a brief spinning sensation. It's a simple mechanical problem that can and should be corrected with physical therapy. Okay, so you got to do some work on it. And not with medical or surgery, says Whitman. Okay, that's good. Number 2, your your ear's balance system controls blood flow. I didn't know that. We've learned that our inner ear balance system contributes to the control of our blood flow, says Whitman, and that the inner ear has the ability to know which way it's up. That's true. When you move from lying down to standing up, 2 inner ear structures, the ventricle and cochlea, detect gravity. They tell cardiovascular system to direct blood flow to accommodate your change in positions, says Whitman. When that process goes awry, it may cause dizziness. So I didn't know that too. So when you stand up, when you sit down, when you land down, your blood pressure and the direction of the blood changes. Number 3, low vitamin B12 levels can cause dizziness. Deficiencies in this essential vitamin may lead to a number of neurological problems, including feeling off balance and having low blood pressure and decreased blood flow to your brain. Wow, says Whitman. Vitamin B12 deficiency is easy to detect and treat, but is an often overlooked cause of dizziness, he notes. So I hope we can get B12 from our common foods and the common meats we eat. I hope it's not I guess since most of us not getting dizzy, most of us are getting our B12 on a regular basis. Number 4, dizziness may be a symptom of heart disease. Okay, nobody don't want to hear that. None of us want to hear the heart disease. One simple cause of dizziness is sudden movement, like when you get up too suddenly from your seat or bed. Okay, like having super speed, I guess. But sometimes dizziness is a sign of a heart condition. Among the cardiovascular related causes of dizziness are leaking or narrow heart valves, like atrial fibrillation and atherosclerosis, says Patricia Ballou, PhD, Associate Professor of Physical Therapy at the University of Southern Western Medical Center in Dallas. These can cause dizziness because they reduce blood flow to the brain, according to VEDA. Migraine headaches, which is true. When we get a headache, or especially a migraine, we lose our balance and the world seems to be going topsy-turvy. It surprises some people to know that dizziness is commonly linked to migraine disease, either with or without headaches. An otologist, neurocologist, and ear surgeon at Duke Medicine in Durham, North Carolina, other symptoms of migraine-related vertigo include sensitivity to motion, light, and sound. And Dr. Tucia, about 40% of people who have migraines experience dizziness or vertigo, according to the VEDA. Number 6, feeling dizzy may be related to anxiety. Many people who experience dizziness, especially in their 20s, okay, so the young people, may also have anxieties, says Dr. Whitman. They usually don't want to hear that dizziness can be linked to anxiety because it suggests that it's all in their head, he notes. But what's in your head is in your brain, and anxiety can reflect a brain function disturbance that's possibly genetic. Compared with people who don't have anxiety, people with anxiety disorders appear to sway more when subject to a moving visual environment, Whitman says, and they sway in a way that seems to be synchronized with the visual movement. These people may be abnormally sensitive to visual stimulation because their dizziness can increase when they're watching moving objects or walking through a large, bright store, says Whitman. This is called visual dependency, and little is known about how common it is. We need to develop better tests of visual dependency, and we need laboratory tests for what we can call anxiety disorder, says Whitman. It's likely that in future, these disorders will be reclassified in part based on genetics. Number 7. Oh, this is common to all of us. A boat ride or waterbed can cause dizziness. Basically, he's saying a moving object that we're either lying on or standing on. If that thing is moving, especially at a high rate of speed, it can cause dizziness. If it's moving slow, we usually don't get slow there because we adjust to the rhythm of it. It's pretty common to experience a rocky, dizzy feeling on your first day back after a cruise, says Carl Foster. For a few people, this feeling called mild decorblement can last for months, or even years. Some 75% of all sailors can experience such dizzy spells. Airplanes, cars, and trains can also cause a wobbly legs feeling. Even relaxing on a waterbed can cause dizziness. I remember I had a person or a friend who used to tell me she would get dizzy being in a car. I would take it as a joke. I didn't take it seriously. But now this article gives precedence to that. A moving car, especially when it's on a rocky, bumpy road, can cause dizziness or even vertigo. Number 8. Dizziness and vertigo may be side effects from medication. Okay, so again, it's medical. So many drugs can cause dizzy spells that there are too many to even list, says Dr. Whitman. That said, high doses of blood pressure medication can cause dizziness, especially in older adults and in people who have started a dose that's too high for them, says Whitman. In my dizziness clinic, I tend to start people on ultra-low doses of medication. Sometimes less is more. Check to see if any drugs you are taking may include dizziness. So read the label, the caption on the bottle to see the side effects that any medication that you are taking may cause you, whether it's over the counter, prescription from your doctor. Check the label and see what are some of the side effects. Check to see if any drugs you are taking may include dizziness, vertigo, or loss of balance as possible side effects by speaking with your pharmacist or physician. So even if we buy over-the-counter drugs, we can still ask the pharmacist questions about that particular drug because it is a drug. A careful review of medication lists and looking for opportunities to decrease dosages can sometimes yield surprising benefits, Whitman adds. Don't think you shouldn't take a medication just because dizziness could be a potential side effect. Most people don't experience the side effects a drug may cause. And that's true. Number 9. Your diet or dehydration could make you dizzy. Even mild dehydration, I've heard it before too. When you become dehydrated, you become light on your feet, your hands start to become woozy. And if it's woozy, that's an effective dizziness. Even mild dehydration may be why you are feeling dizzy or lightheaded, according to the American Heart Association. Dehydration can also cause blood pressure to drop, which can lead to dizzy spells. Dieting can also result in feelings of dizziness because some diets cause dehydration. According to the AHA, mild dehydration that follows the loss of just 1 to 2% of your body weight can cause dizziness. Wow. So a mere drop of 1 to 2% of your body weight can cause you to become dizzy. Especially if the loss is quick. That's what it's probably meaning. A quick, rapid loss in body weight. And number 10, there are several less common causes of dizziness and vertigo. Pay attention to all bouts of dizziness because, along with other symptoms, they could point to something more serious. See your doctor to rule out health problems related to frequent or severe bouts of dizziness or vertigo. Even though less than 1% of my patients have a life-threatening or previously unsuspected cause of dizziness, such as a stroke, warning symptoms, or a brain tumor, I still take all cases of dizziness very seriously, says Dr. Whitman. If you have a brain tumor, it's usually not the only symptom you have, he says. On very rare conditions linked to vertigo is Meniere's disease. If you have prolonged episodes of whirling vertigo along with hearing problems in one ear, it could be Meniere's, says Dr. Whitman. He estimates that this affects only about 0.2% of the population. It's sometimes found in adults between the ages of 40 and 60. Though it can't be cured, it can be treated. So that's it, my good people, of some of the effects and causes of dizziness and vertigo. If you like the discussion, give me a thumbs up. If you'd like to subscribe to the channel, subscribe. If you'd like to share it on a social media platform with a friend, a family, or relative member, please be my guest. Thank you for stopping by, and I wish you a wonderful and enjoyable day or night.